Nigeria, access to quality health care remains a challenge for many. By 2023, less than 5% of the population was enrolled in the National Health Insurance Scheme, leaving an estimated 120 million Nigerians without health insurance coverage. For countless families, healthcare is not just a necessity, it's a luxury they cannot afford. In rural areas where healthcare needs are often the greatest, the situation is even more critical. But amidst all these challenges, an innovative solution is transforming the narrative.
Um, Market doctors say what we want to do, what we typically want to achieve is just to make sure we create access to healthcare for everybody, every common person, the man walking on the streets. That's just our aim, is to create access to healthcare to the common man.
Mobile market doctor stand out? What's very unique about market doctor?
Yeah, what makes market doctors stand out? The service we render. Typically people feel that when people render service to the informal sector, to the underserved communities, that the quality of the service has to be lower than what is being offered at big hospitals and all of that. But no, the quality of service we offer is as good as what anybody can get. You understand? Because we have partnerships. We have the kind of medications we use. We use qualified staff. In fact, we are so detailed in all of that that if someone said that they got a malaria medication from market doctor, we can tell what the medication was. Wow. That is how far we've gone in our quality assurance. If someone said, oh, I saw market doctors at this market and I was diagnosed for this and this was the medication I was given, we can tell the particular medication, the brand that was given, because we do a lot of, everything is done from a central system so that the quality delivered at every location is good. We also make sure that the commodities that are available for our clients are commodities that gives them an array of choice. You see, there's something called dignity in when you want to give someone who is not too rich a drug, a treatment, or a commodity. The fact that the person is poor or the person is not very rich doesn't mean that you give anything to the person. So we are very big on dignity and how we give the care. So we don't treat our people anyhow. We don't reduce the quality of care we give them. We don't reduce the quality of the medications they get. What they get is what can be compared to what can be gotten anywhere, despite the fact that we're giving it in the market. Now, the other thing that I would say is very unique about us is that we're one of the only people in Nigeria taking healthcare to people. Oh. People usually come to healthcare. We are taking healthcare to people. And when you take healthcare to people, what have you done? You've removed the hidden costs of healthcare. Remember, the kind of people we deal with are people that earn daily income. So it means if they don't go to work today, they're not going to earn income for that day. So it means if they have to access healthcare by going to an hospital or traveling to another village or something to get healthcare, it means that day they are not going to make income. So add that cost to the cost of what they spend. So they're going to be more impoverished. And that is what we're avoiding. We're saying that people do not need to lose man-hour time, and they do not need to lose income just because they want to seek healthcare. So we take
of them don't like to leave their stores to go to the hospitals, and so we brought the clinic to them in the market to help them, so that even if they have issues and all and they can't go out of their stores, the clinic is just right behind them to just have a quick walk-in session and then back to their stores. So it's very, and it has helped a lot of the market people here. So I mean, we've had a lot of clients and they've been so appreciative of our efforts to them. Yeah.
My name is Mrs. Patience Udoala. I am the head of clinic. So basically what we do here, we offer primary health care to the people in the market. Should I say useful? Yes, they have been coming. Health is not something you push to people by force. It's something you give them when they need it. So most times they don't like leaving their shop, coming out for any medical services. We also have another team called Elosoke. So they are the ones that reach out to them door to door, individually to their shop, check their BP, their vital signs. Then if there is anything required, they will get it. Then another thing, if it's something we cannot offer them at the shop, they will bring them upstairs to the clinic. They can also get that aspect of services. But we try as much as possible not to take much time, because they always want to go back to their shop. They don't want to spend more than 2 to 3 hours in our office. So we try as much as possible to meet up to the time. So the turnout is perfect.
As you can confirm, for many beneficiaries, Market Doctor is a lifeline. For Antonia, who has been in New York for the most part of her life, it was a surprise to have an affordable health facility that provides quality health services to her. Here's what she had to say.
My name is Antonia Oshode. I'm basically based in New York, and ever since I have a store right here, right? For the past 2 years, I always kind of put this place down. That maybe they're not so good, until when I tried this place, it's so good. So I will recommend people to visit and then see the doctor, because I'm not going to lie to you. I believe in nothing is good in Nigeria. Nothing is good in Nigeria. But when I had pain and I have to come here, excellent. I was treated really good. So please don't. What I'm just trying to say, you can't judge a book by its. So I recommend people to come. Thank you.
Mrs. Mustafa, who's been patronizing the facility for the past 3 years, also shared her experience. Her own case, she's been able to tell other people about the facility.
My name is Ms. Mustafa. I'm inside Production Market. I'm one of their patients. You understand? I'm one of their patients here, and I've been benefiting this hospital since like 3 years now. I liked it. I even like them to even big and bigger than this. There are many patients from me which I introduced to them, and we are benefiting it. We liked it. We are enjoying it. You understand? Whenever we have anything like crisis, we run to them, and they are always there for us. You understand? I like their service.
Alhaji Baga is another beneficiary of the Market Doctor initiative.
This place are helping me many places because there was time they brought some doctor for the teeth. They helped me wash my teeth and very enjoying it. After that, I'm the BP patient, so I'm coming here. They are treating me well, and everything is going normal. I'm feeling okay because there was time the thing affect me go up too much. But after I'm coming to a market doctor, they are treating me well. I'm very happy. I enjoy them. So and thank you very much. I always be being with you people. Anytime I feel somehow in my body, so far as my market, I'll just climb up to come and meet people. You give me medicine, I will drink the medicine, I enjoy myself. That's it. And thank you very much.
From the testimonials, beneficiaries agree that Market Doctor offers quality services at pocket-friendly prices. One key thing that we've noticed about Market Doctor is that it is predominantly a female workforce. This staffing strategy, as explained by Dr. Yetunde Ayo, stems from her observations Despite its successes, Market Doctor faces significant challenges, including the Japa syndrome, the migration of skilled healthcare workers. And to address this, the organization from time to time partners with agencies like USAID to organize capacity building trainings and workshops which train and equip young people in areas like soft and hard skills, health research, basic first aid, and healthcare management. On Japa syndrome, the head of operations, Folashade Gumola, said,
It's a training organized by USADF and LSCTF to upskill young people in Lagos State and infuse them into the health system. We train them on soft skills and then introduce them into health related topics like research in healthcare, monitoring and evaluation, school health services, and basic first aid training, and a few other topics, HMO training too, and a few other topics in healthcare.
Capacity building trainings such as this is very necessary to ensure that young people get the right information, and quite interestingly, some of them shared their key take-homes. Abiodun and Joy spoke on the impact the training had on them and what they will do differently moving on.
My name is Abiodun Ahmed Olaiton. I have learned a good customer service relations in this program. At least yesterday I learned about not categorizing people in some aspect, because you know this kind of customers that you attend to, you actually have them in your own family. The kind of customers you attend to, you actually have them in your own family. So not categorizing anybody or placing one person above another is what I have actually learned from this program. And also today I have learned a very good one which has to do with the proposals. Before now, many of us didn't know the difference between plans and proposals.
Okay.
You understand? We just know that plans, whenever you want to do a business plan, it is actually just a business plan, it is not a proposal. So we have learned the difference of what a business plan is and a proposal.
My name is Akwa J. Joy, and from the training we've been having, we've gotten a lot of insight on customer service, and now we're learning about writing a proposal. So these are things that will be a point of support in the healthcare business, because we have the nurses and the doctors in the front line, and they actually need people at the back end to run all these things like customer service and attend to the patients after care services. So one thing I would do differently after this training would be, since I would have been equipped with all these principles and practices on how to help the frontliners with the work of aftercare and following up with patients, I would be able to give value to the healthcare industry. Thank you.
Scenes of the workshop participants expressing gratitude and sharing what they've learned. Market Doctor is more than a healthcare provider. It's a beacon of hope for underserved communities. By bringing affordable healthcare to the doorstep of those who need it most, it is changing lives and inspiring a new generation of healthcare innovation. This program was brought to you by iJet TV, the innovation TV in Africa.